Dr. James Yoder here with On-Site PT. We're talking lumbopelvic mobility, stability, patients with low back pain. This is, I think, the first place you want to start when you're having some of these issues, especially people that are having problems along the belt line here. One-sided pain, one side or the other across the low back, shooting down into the butt. That radicular pain down the leg, this is where you want to start, this lumbopelvic junction. It's really important. So I want to show you a few things to get started with all that and see, are you stabilizing well? And if not, kind of some stuff that you can do. These are the self-assessment tests, okay? So the first position we're going to get into here is we're going to lay on our back. We call this hook lying, knees up. And as you see here, I have this belt on so you can kind of see my pelvis moving, right? So what I like people to do for this first self-assessment test is slide their hand under the small of the back. And what I want you to do is, step one is just smash your hand. So you see me posterior tilt my pelvis when I do that, okay? I'm not lifting my hips up, and I want to make sure I'm not doing a sit-up. So my neck should stay back, my shoulders stay back. I'm simply just, watch my belt, posterior tilting my pelvis. Now, step one is getting that position, being able to hold and breathe, okay? And I want to breathe through my stomach. Watch a few of these. Not my chest. I don't want to breathe from up here, okay? So just being able to hold that position, you should feel your deep core muscles turn on and breathe and maintain that. For some people, that's tough, okay? So see if you can do that. If you can, let's go to this. Step two, you're gonna come here and you're gonna lift one foot just a few inches off, okay? And then you're gonna try and lift the other foot off. First side down, second side down, and then relax, okay? Now, the whole time you're doing that, you need to keep your pelvis back in a stable position. So by lifting the legs and marching, we're loading our pelvis, making it hold the weight of our legs and seeing how stable we're keeping it. So you're going to posterior tilt, lift one side. That's not too bad. The other side, this is where it's really hard. Your pelvis is going to want to tilt forward, keep back, keep that pressure back, hold, maintain your breath, let the first side down, let the second side down, and relax. The other thing you'll find yourself wanting to do as you tilt back is lift your head up. Keep that head back. Make your pelvis do all the work, okay? Those neck muscles aren't going to help you stabilize your pelvis, but that's a common compensation we see. Sometimes start with the left, sometimes start with the right. Another common mistake is people want to march way up here, you know? It's a small, controlled march, really concentrating on keeping the pelvis position. The next position we're going to do is coming over to your stomach, or we call this prone. Prone stomach, supine back. So you're going to come here and we're going to do the same thing but on your stomach. So you're going to posterior tilt your pelvis right there, okay? We don't want to have this big arch. That's why a lot of people, they sleep like this. They already have an arch in their low back and this position accentuates it. That's why sleeping on your stomach can be bad, okay? So we're here, we're going to posterior tilt our pelvis. You know you're doing it right because your butt muscles will tighten. Okay, and then we want to lift one leg up and the other leg up. Now, what are we looking for? If you feel the front of your pelvis here, you'll feel this bony prominence, okay? Put your fingers right under that, posterior tilt, and your pelvis kind of comes up off of that, okay? And when you lift your leg, you shouldn't be smashing your finger, okay? Because if you arch too much, you're going to smash this hand right here, okay? So, posterior tilt, lift one side, really tighten the butt, okay? Other side, and relax, okay? And you're trying to make sure that pelvis doesn't tilt forward and smash your fingers, okay? So that's a way to do a couple self-assessment tests on the pelvis. See if you're able to stabilize in those positions, and if you can't, then you're not using that posterior tilt position, which is really important for, you know, when we go overhead, okay, when I lift overhead, if I'm doing this, how many times do we see people do that? Or do we just see people standing with this tightened anterior pelvic tilt position, okay? So this is a way to start facilitating getting into that posterior tilt, strengthening the deep core and the glutes.